Hello, everyone. Welcome to Jump In with Jumi, your favorite Thursday BlackDoctor.org show. I am your host, Jumi, and I'm so happy that you all are here and back and ready to enjoy another amazing episode. This is actually the second episode this week as part of my two-part special on Black maternal health. On Tuesday, we covered, how structural inequities and social determinants really impact a woman's ability to get the right care when it comes to her maternal health. We also talked about how to really get the best preconception care and how to reduce your risk for, common major pregnancy-related health issues. But today, we're switching it up and we're talking about what's happening with our mamas after pregnancy. We're going to talk about postpartum. We're going to talk depression. We're going to talk about mood disorders, body image, the first trimester, and it's just going to be a great conversation. So thank you so much for tuning in. If this is your first time watching, welcome. If you've been here before, let me know. Welcome again to all my faithful jumpers who are here week after week, getting this engaging and empowering conversation. So we're going to talk first and foremost about, what is happening with women postpartum. African-American women are twice as likely to experience postpartum mood disorders, depressive disorders, but they're 57% likely to not get treatment for it. And that is a major issue. So we definitely need to talk about it. Have you ever had a conversation with a woman about their postpartum experience? Have you really gotten down to the nitty-gritty about what they're experiencing, body image issues that they might be having? If not, stick with me today because we're going to talk about all of that. We are going to have mothers talk to us about their respective journeys and really an expert to help us unpack all of that together. But before I introduce all of those guests, you know how I do, and that I have a question of the week for you. So my question this week for you is, true or false? Postpartum mood disorders don't always show up immediately after birth and can take a year to actually show up. True or false? Is that true or is that false? Do postpartum mood disorders start immediately or can they take some time to really develop? Let me know what you think in the chat. Let me know where you're tuning in from. Make sure you're liking this episode and sharing this episode because we're going to get started soon. I see people saying true. All right. And I see we've got someone from South Africa joining. Welcome to the show. Patsy, first timer, thank you for joining. Thank you all for tuning in. Now it's time to introduce one of our first guests, and it is a mother who is here to tell us all about her postpartum journey. So let's welcome Miss Shayna Flanagan to the show. Welcome, Shayna.
Hi. Hello.
Hello. How are you?
Oh, I'm fine. This is my little baby Duke, who is 12, 13 days old?
13 days old. Wow. So you really are like in the mix of everything when it comes to
I'm fresh. I'm fresh. I literally am recovering from my C-section.
Wow.
I am at home with baby Duke. Just trying to get myself together so I can heal and get my mind, body, and soul together to take care of my family.
Absolutely. So yeah, talk about that. I know this is your second child, so what has your postpartum experience been?
Well, my first time was 2 years ago. I have a son that's 2 years old. And that was a crazy journey. That was a really crazy year for me because that year prior to, bless you, prior to having my son, I lost my mother. So I was grieving. And I didn't know the signs of postpartum depression. I thought I was still grieving. When I had my son, literally the week I had him, I caught an infection at the hospital and I nearly almost died. They couldn't figure out what was going on with me, why I was sick, why my blood pressure was so high. I was just sweating. It was really, really bad. And after that, I had preeclampsia. The whole pregnancy, I didn't have preeclampsia, so I got it after I labored. And so I was on medicine, and then that's when it hit me. The crying, the sadness. Like I love my baby, but I was just so not happy with myself, and I didn't know why. And it was scary because I never, ever felt like that before.
Wow.
And it was a tough time for me. This time around, having this one, it's still early. I can still have postpartum depression, but I had a great C-section delivery again, and I had an African-American Ob-Gyn, and I think that made such a big difference this time around because she did all these tests that I didn't do the first time with the first physician. And she didn't discover a lot that was with me, but it was good for her to test those things.
For sure.
Just to help to prevent issues down the road.
Right. So you got that support that you were looking for the second time around, and you feel like it did make a major difference from what you experienced the first time to what you've been experiencing so far now.
I think the first time I didn't get the proper care. I would say I was 3 years younger, and I just felt like they didn't test me for the things that I should have been tested before.
What kind of things, and what support do you wish you would have received from them?
From the first time?
Yeah.
I think I should have came back like often. Because the closer I was going to get it closer to my due date, I started to experience swelling in my legs, in my ankles, in my arms, in my face. And I would go to this doctor, and he's just like, "Oh, it's fine. It's normal. You're just gaining weight." And I'm just like, "Well, it's my arms they're huge. I can't walk. My ankles are huge." And this was all before the surgery. And they didn't take my blood pressure, which was all kind of weird. But when I gave birth and I'm in recovery, my blood pressure was 160/90, and that's super high.
Yeah.
And I think it's because I had an infection and no one knew.
No one knew. So how was that different from now this time when you have an African-American physician and you've gone through that experience and you were able to really have the right conversations and advocate for yourself?
All the way into that Friday I had him, I went to see her twice, and she checked for preeclampsia and high blood pressure. She kept checking me, my heart, the baby's heart, my legs, my everything. She was just checking. And I think that was so important because that's how you can just overlook something, you know?
Absolutely. So that's an amazing thing to really understand. It's like knowing what to look out for, knowing to talk to your physicians about that, which is something we talked about on Tuesday a little bit, where it's like being able to advocate for yourself and ask the right questions and know that the doctors are there to serve you and to make sure that you're okay. That's incredibly important. So how do you think that right now, your second child, what do you think that going back to work has done for, being able to manage your second pregnancy and the feelings that you might be experiencing?
Going back to work? Oh gosh, I can imagine. I think that, me, I'm such a workaholic, so I am checking emails when I'm not supposed to, and I'm still talking to clients and colleagues and stuff like that. But I think that you do need the time. I need the time. Let it go. I need the rest. I need to sleep when baby's sleeping. And
easier said than done, though, right?
Yes, I've been getting better. When I first got home, I was bad, but I said, Shayna, you're not going to recover the way you want to if you don't get the proper sleep, right? Because sleep is everything. Sleep will help me lay down and elevate my legs, and just other things, just eating nutrition and eating great, eating right, all those good things. So I can recover well from this, because if you don't, it's hard. C-section, vaginal birth, it's a hard recovery. I try not to get addicted. Of course, they sent me home with these pain medicines that are very addictive, and I'm trying to wean myself off of it. and replace it with Tylenol, because I think that's so much important to do, because you can get addicted to that, and I don't want that.
You're balancing a lot of different things going on, just trying to take care of your body, trying to take care of your babies. So, you know, we're going to talk about body image a little bit later, but is that something that you've struggled with the prior baby and now with this baby, or how have you really dealt with that?
Last time I had to get off of Instagram this time, right? This time, I'm really not on social media. I'm tired. Like, I might post a picture once of baby Duke, but I'm not on there searching. But I would say my last pregnancy, about when I was dealing with postpartum, I didn't like the fact that it was taking so long for my uterus to shrink and my stomach to shrink and my skin to whatever it was gonna do.
Blow back,
right. And it took a while, you know. And then I gained 75 pounds my first pregnancy. That's a lot of weight. And it took me a whole year to get that weight off, that 75 pounds.
Did you feel pressure from the media?
It was a lot of pressure. I was on there and I was watching like Kim Kardashian, Chloe, because she had her daughter around the same time I had my son, and she was looking great. And I'm like, what is she doing?
Like, I need to get that back too. And
give me that shake. Give me that chef that she has. Like, you know, but I think, you know, it was different for me because I did not want to hurt myself trying to get that snapback. I think it's important for you to heal right, because if you don't, it can hurt you in the long run. So that's something that I need to think of. That's something I'm thinking about now that I would not think about the first time, is that not compare yourself to these celebrities. You don't have no idea. Their body's different than yours, and you don't know what type of team they have or what they're doing.
That is
that time.
Yeah, they have an incredible amount of resources at their disposal. Get their bodies. Got people cooking for them all the time, shopping for them, doing everything, and they literally can just work out multiple times a day, and that's just not realistic.
Right.
And that's what we need to make sure people understand. Like, that is just not a thing at all.
And if you have a C-section, you're not supposed to be cleared until 6 weeks.
These are really common steps.
And even 6 weeks is not enough. Sometimes you need 10 or 12, and
however long your body needs. That's really what it should be.
And you listen to your body, right? I learned how to listen to my body and just like, okay, Shayna, like, you know, you're not ready, and just do that, because you can really hurt yourself and you get these other problems like a hernia or all this other stuff, and you don't want to go down that road.
Oh, not at all. Well, thank you for telling us about your particular journey. Definitely going to have you come back, but continue to love on baby Duke for a little bit while I bring up Dr. Crystal Clark, who is the expert for today. So love to add Dr. Clark to the stream. Welcome to the stream, Dr. Clark. How are you?
I'm great. Great to be here. Thank you for having me, especially during this very important week of Black maternal mental health.
So, absolutely. I'm super excited that you are here. If you want to go ahead and tell the viewers a little bit about you and why I wanted you on today's show and what you do for Black women when it comes to postpartum.
Yeah, so my specialty is all about meeting the mood, where the hormones meet the mood, basically. And so working with women through these very vulnerable and precious times in their life, pregnancy, postpartum, trying to conceive, such as dealing with IVF, all the way through perimenopause. So my specialty is in reproductive psychiatry. I work at Northwestern Feinberg School of Medicine, where I'm an associate professor. And there I run and co-direct the Women's Mental Health Advanced Training Fellowship, dealing with perinatal mental health, as we're talking about today, because this is so important. And I also am the president of an international organization called Marseille of North America that is focused on parental mental health, however you define your family. But, we deal with women and other persons who choose to conceive and have children deal with depression, whether it's post-adoption, postpartum, during pregnancy, and during times of battling with infertility. So this is such an important
Across
topic.
the spectrum. That's amazing.
Absolutely.
So there's so many different types of postpartum disorders, right? And why is it difficult for women to kind of recognize or admit that they are having a postpartum issue, especially when it comes to mood disorder? Because research shows that as many as 50% of women don't report postpartum depression.
Absolutely. It's a public health emergency at this point. I mean, we're talking 1 in 7 women, as much as 1 in 5 women will have an onset of postpartum depression. So, I mean, most of us know at least 5 women, right? One of those 5, if they've had children, have likely suffered with postpartum depression, and more often they're likely to have suffered in silence. And the issue is really, to your point, Jumi, your question about, why are women not reporting it? What is it? There's a lot of stigma. There's this idea that you have a baby and you're just supposed to, you're a mom, you're supposed to be able to handle it and everything's supposed to be great. And, having a child is, just supposed to be an amazing thing, and it is, but there are some real challenges that go with it. And the media doesn't help, because every time a celebrity jumps out there like, oh, it was great. I mean, I just had a wonderful, magical experience of pregnancy, and then I had a baby, and then my body snapped back, and we're just, posing with, just 2 days later, like nothing happened. I'm just all in my rhythm. I'm looking flawless. My hair is done. My nails are done. Yeah, that gives this really false perception that this is what's supposed to happen. And if it doesn't happen that way for me, then something must be wrong. And it's other women too who are in closed doors struggling, but when they're out in front of their family and friends, they're like, oh yeah, things are going great. Because they're scared to talk about it and scared that maybe something they're experiencing is actually abnormal. We need to talk about it more.
We need to talk. Well, I'm glad we're talking about it today and making sure that women know that they're not alone on this journey, and that there are things that they can definitely do to make sure that it's not anything that stops them from being able to live a life. So what are some risk factors or triggers for postpartum depression?
So risk factors are anything, there's some small things that people don't think about. One of the major risk factors for postpartum depression is support, having enough support. And it's not about what someone else defines as support for you. It's about what you define as support. So if you feel you only need your sister or best friend or whomever is available to come by once a week, then great. If your mate's partner, husband, whomever is there and has some time off or is able to work around their schedule in a way that's very supportive and that's enough support, great. But it's really about that woman, number one, defining what support means for her, and number two, being able to say, this is what I need. So often women are like, okay, I got this. I got to figure it out. I got to stay up all night. I got to feed the baby. My husband's working. And I tell my patients, I got to do it all. And I'm like, having a baby is working during the day. And so, yes, your partner might be working too. Y'all both are in this together. And there has to be some agreement that you're both going to be tired, right?
For sure,
because as Shayna talked about, that sleep deprivation is real. That is another risk factor. If you are never getting any sleep because you are doing on-demand breastfeeding every 2 hours and having trouble, getting some solid blocks of sleep, and, depending on how sensitive you are to that sleep deprivation, you're likely to develop postpartum depression as well. So I advise my patients, I'm like, you need at least a 4-hour block of sleep. Yeah, you might not be perfect. You might not get it every night, but as often as possible, scheduling, if you are in a relationship, if you are married, scheduling, okay, I'm going to have this 4-hour block from 6 to 10 or whatever. And then I'll get up with the baby and I'll do this every 2 hours or whatever. But yeah, and if you're a single mom and there's a way to hire a night doula or have a friend or family come over, or
so you can get sleep or some rest or something.
You can get some sleep as often as possible. It's all about trying to find that self-care and reset.
So
those are a couple of major things.
So with somebody that is diagnosed with it, what does treatment look like, and how long does it last?
So treatment looks like, it really depends on the individual. Treatment can last up to 1 year. So for someone who has maybe had an episode in the past, so like Shayna mentioned, with her first pregnancy, she was having a hard time determining, was this grief after her mom had passed versus, am I experiencing postpartum depression? So, and someone like her who hadn't had any prior history of anything, well, started either therapy, depending on how severe her symptoms were, or gone to medication if they were more severe symptoms and you want to get back to yourself a little quicker. Actually, I tell people sometimes it's about how long you want to suffer through this and try to work through therapy. So, but for her, 6 months might have been enough of treatments for her to get back to normal. For someone who has had symptoms before, it might take a little bit longer. So we might extend that to a year of treatment and see if we can pull the treatment back and see how that person does. But someone who has a history of depression or anxiety or has had multiple episodes, so 2 or more, likely the treatment might be lifelong. And I tell people it's kind of like realizing that you have a congenital disorder that you weren't aware of, such as type 1 diabetes or essential hypertension. It's one of those things that if you're vulnerable to that, if that's already in your genetic makeup and you take away that medication, then the illness just comes back. We don't have a cure yet for depression, unfortunately. It's something we can put into remission, but not something that is cured. So for those more vulnerable, you stop the treatment, it unfortunately comes out of remission.
So you saw the question for the day of like, is postpartum that starts just immediately once the child is born, or can it happen a year later? Answer to that?
Yeah, it can happen up anytime within that first year.
Anytime within the first year.
And so it's actually quite common 3 to 6 months. Sorry, Jimmy, what did you say? We're talking about you.
You said you can happen within the first 3 months, or what did you say? Sorry, I lost you.
So 3 to 6 months is a high vulnerable time for onset of postpartum depression. And then 6 to 9 months is actually an even more vulnerable time for risk of self-harm during the postpartum period. So, so the whole year is actually quite significant.
So talk about that, the 6 to 9 months in the self-harm. What does that look like? So it's like, what are those statistics on that?
Yeah, great question. So there are not enough statistics on that. We have not, the CDC, this is something some of us experts are pushing for, and there have been more mandates and plans to look closer at maternal mortality as it relates to suicide. There's not a clear statistic on how often women who die during that first year postpartum, how many of them are dying from suicide. We know the maternal mortality rate, but we don't know how many are actually attributable to suicide. And we often don't know how many have actually attempted. But there is a high risk for attempt during that 6 to 9 months. And why 6 to 9 months is likely because they've been suffering so long trying to, fight through, but the symptoms have gotten more severe. And by the 6 to 9 months, they're just so severely depressed that they're having suicidal ideation and lots of self-harm.
Wow. So even just knowing that right now, why is it still that, after the baby is born, it's just like, okay, mom was good. We're not going to take care of you anymore. We're just going to focus on the baby, or you just go to your pediatrician and we're done with you. Like, what is that changing? Are the conversations happening that need to happen to make sure that 6 to 9 month statistic doesn't continue to grow?
Yeah, no, that's a great question. There's definitely lots of mandates rolling out state by state throughout the United States and globally to screen women, and that's great progress for sure, but not enough. The concern is that for Black women, let's say, they might get that questionnaire and be like, okay, yeah, I'm good. I'm just gonna mark it out. No.
Right.
I have a close friend who did that. She was like, yeah, I got that questionnaire. And I just said no to everything. But she was actually suffering. And if you don't follow up and really, I think, appeal to that woman and establish a rapport with that woman and say, hey, I noticed you said no to everything. Are you really okay? These are the symptoms to look out for. You have to, it can't just be paper and pens and, that's the end of the conversation. You need to educate give that screen, but also follow up with a dialogue. Like, are you sure you're okay? How are things going?
Mhm.
And unfortunately, a lot of the first line docs, that being the Ob-Gyns and the pediatricians and the family medicine physicians, they don't necessarily feel as well equipped. This is not their area of specialty. They're like, okay, I
Not
delivered the
their
baby.
area?
Right. Yeah.
Whose area is it then if it's not the first line of people?
Exactly. So I'm usually not the first line. By the time I see somebody, someone's like really sick, more often than not, unless they're just very progressive, have, are not as concerned about the stigma of mental health.
Mhm.
And but yeah, often our OBs are like, okay, more and more, thank goodness. They are, I sit on the American College of Obstetrics and Gynecology task force to help to roll out and implement more screening and treatment practices in the OB-GYN offices around the country. But there has definitely been some who are like, okay, but this isn't my area. I'm like, I go in, I do my exam, I can give this paper screen and then what, they're just not trained to get into the mental health symptoms and figure out what's going on. So there's a lot more initiatives around that so that people feel more equipped and confident about asking these questions, but also once they get an answer, what to do next. And that's extremely important as well. And honestly, there's a dearth of mental health providers who are available. So it's like, okay, the OB-GYN is like, all right, I know for sure this woman is depressed. I think I should start antidepressant, but then what?
Right.
Can I refer her to you? But what if there's no me out there that's close to this practice? Yeah, it's a huge issue.
So hopefully things will continue to get better. I mean, they're not just dealing with that, they're now also dealing with body image issues. And so we live in a society that promotes and expects and celebrates perfect bodies after childbirth. Like Shana mentioned, that celebrity snapback, that comparison. How damaging has the media and just cultural expectations been to contributing to postpartum body shame?
Yeah, I think it's a huge issue because what I would love to see is women having more real conversations. We need some red table talk, with Jada for postpartum depression and body image issues. And because we would love to believe that everyone is just having these amazing pregnancies. I thank Beyonce for being honest about having a miscarriage. That's, that's a huge issue that a lot of women deal with. But otherwise, we would have been left to believe, well, I mean, of course, Beyonce is just having, living this fabulous life. It's easy for her. And I think the more that celebrities are able to normalize that, okay, postpartum depression is real. My body didn't snap back. We are aware of the picture of, you all may be aware of the picture of Khloe Kardashian that came out that she's really upset about. And it's a beautiful picture of her, right? But she's like, this is not, this ain't that smooth finish y'all normally see. And I think it's so important for women to be real about what their bodies are really looking like. Yeah, we got some of us got some lumps and bumps, and that's just natural variation in women's bodies. Okay. Yeah, so it's so important for, I think, media and celebrities to do women some justice and not have us believing that we're supposed to have perfect bodies, that have smooth skin, perfect complexions, no moles.
Right. So what are some expectations of what bodies should look like after pregnancy? What is some realistic?
Yeah, so the real deal might be scary. I'm gonna tell y'all, it might be scary. So we're talking about, immediately postpartum swelling of the feet and arms. That doesn't go away right away. Sometimes that might take weeks to go away. Of course, you should be checking with your doctor. Eating potassium-rich foods is very helpful. To decrease the swelling and reduce the sodium that you might be retaining. So that's one way to deal with that. But yeah, that swelling can be around for a while. But also, I've had patients complain about new moles that have popped up on their body, skin tags, hair loss, all of that. And some of those things don't repair right away, or may not, skin tags may not go away at all. So, following up with a dermatologist or an appropriate professional to work through some of these things might be necessary. But we also have women who are dealing with, vaginal tears. They had a baby and they had a, first, second, third, unfortunately, in the most severe cases, fourth degree tear. And that's not only traumatizing, but can take a while to heal from as far as pain and even just looks. So I've had some patients be like, I don't look right down there anymore. Yeah. And we've talked about that, right? It's like I had a patient say, well, my doctor told me, well, that's okay. I mean, who's looking down there anyway? And I was like, well, that was a terrible answer.
Wow.
I'm like,
really?
well,
yes. There's so much cultural and like just unnecessary things that happen that make women not want to have the conversations that they need to have. Yeah,
exactly. Because she felt ashamed because she was like, am I supposed to be okay with this? And I said, no, it is okay if you're not okay with it. So we worked through that. I encouraged her to explore her options. If she wanted to see what, surgery, cosmetic surgery would be, then explore that. If she feels that she can live with it, then it's learning to accept that or work. If she doesn't want to get surgery, working through accepting that and determining, so some of it was just like, okay, we know vaginas are different. Everyone has, different looking, there's no perfect vagina either. So working through some of that, she ultimately decided that she was able to accept these changes and she wasn't going to get surgery. But yeah, I think it's very individual and it's okay, whatever the woman decides that she wants and whatever she's most comfortable with.
So you talk about something known as a fourth trimester.
Yeah.
What exactly is that?
So the fourth trimester, everyone knows the first, the second, the third trimester of pregnancy. The fourth trimester is really postpartum. That's a whole nother journey, and I really would say that fourth trimester is that first year. And it's really because your body is changing again after all the changes you've dealt with through the 3 trimesters. It's, your breasts are engorged with milk. So you're going through the breastfeeding. Depending on how long you breastfeed, you're dealing with just the different symptoms of that, dealing with pain when you're too engorged, trying to make sure you pump enough. But you're also dealing with other physiological changes. And then there's the mental aspect of it all. Some women are recovering, most women are recovering, but depending on how the pregnancy went and postpartum went, they might have a longer recovery. I've had patients who needed physical therapy postpartum, and just because of the birth process for them. So there's just this whole period of time where the woman really is recovering, but also getting to know this new life and bonding with this new life. Their child and their families are trying to, adjust. Like this is a new way of being.
Well, I want to bring on, we have another mom who just joined us, and I want to bring her on for her to talk a little bit about her journey, especially with the fourth trimester, because her baby is not a new baby, but it is within a year. So I'll bring on Eka Anderson. And hi, Eka, how are you? Welcome to the show. You're muted.
Sorry, I muted because he's crying in the background.
Okay. Well, welcome to the show. I wanted you to definitely talk about your journey postpartum. And like your son is not a lot older, but you're in that postpartum fourth trimester period. What has it been like for you?
I know you guys have been speaking about postpartum depression, but I was more on the postpartum anxiety and still have kind of that going on. And I know people don't speak about that very often. And I think even myself was new to me. So mine has been more of the postpartum anxiety from PTSD from delivery. That's what I'm calling it. Because I was, in labor for about 12 hours. I was induced, but failed, and so required a emergency section. And so from then on down has been very, very anxiety provoking, and something that you don't even realize until when you look back at it and you're like, oh gosh, that's been awful. So, that's been what we've been going through. Now we're at a point that will be about 18 months soon. On Sunday, he'll be 18 months. and he's still been at home. He's been at home with the nanny, and now we're trying to enroll him into daycare. And I'm still like, I'm asking the preschool teacher, I'm like, can we come speak to the teacher? And we're going back and forth as to whether I can come speak to the teacher or not. And I just want to say to her, please, I'm so anxious about sending him, somewhere new. Can I just come in and look at the school and all of that? It comes from your health to child's health, and just like worrying about different things and worrying about that in general. So that's been my big thing, the anxiety.
Yeah. So Dr. Clark, with postpartum anxiety, because that is one of the major postpartum mood disorders, how common is that? And what can women do when they're experiencing things like Eka is talking about?
Yeah, no, this is great, Eka. Thank you so much for sharing your experience, because postpartum depression is extremely common. It's pretty much as common as, or postpartum anxiety, is extremely common, pretty much as common as postpartum depression. So we're similar rates, 15 to 20% of women will have an experience postpartum anxiety. And we just haven't in the medical community, there's not a what we call a DSM diagnosis. We have to call everything postpartum depression, but we know that there's anxiety, there's postpartum trauma, there's bipolar disorder. There are lots of mental illnesses that women are experiencing in the postpartum period, and obsessive compulsive disorder is a common kind of branch of anxiety that a lot of women experience also.
That's amazing. Well, I'm glad that Eka, you understood what it is and where it's coming from, and the trauma that you experienced through childbirth that is continuing. And it's not happening right after childbirth. What we just said that was going to be 18 months. Like, this is still a year later and you're still experiencing it. So it's encouraging to hear from women like you who have dealt with it and know that it doesn't go away immediately, but it won't last forever, because you're acknowledging it and getting support from the right people for it. I want to add Shayna back to the stream, who is also, she's a new mom. Yes, new mom, second mom, but she has also had her experience. I kind of want to get from all of you all, like, what do you think for women? What's your new moms that have toddlers about how to deal with what they're feeling? And if you wanted to start with that, like, what's your advice for women?
Of how we are feeling.
Yeah, like how can they continue to just be encouraged that it won't last forever, that they'll be okay, and that there is support out there?
Yeah, I would say that it's important to talk, even if you don't want to see someone that's a doctor. Just talk to your family members so they can help you. I think the first time me having my son 2 years ago was that I never asked for help, and I was suffering, and I was trying to do all these things, and I became angry and upset. So I would say talk it out, and then take a break. With like Eka, I had anxiety to leave my baby with my husband. This is his baby too. And I was like, no, you don't know how to do this. I was driving myself crazy. And I just let me go take a walk outside. And it made me feel so much better. And I would just be so upset, and I would just be crying. And I'm just like, Shayna, you have to let it go. Shayna, you have to let it go. And that helped me. And that went on for months. And so I would just say that definitely talk to people and reach out, or, talk to your friends, and don't turn down help. I had my niece was here for a whole week, and she just left yesterday, and my sister's coming on Sunday, and I'm so excited. So this time is definitely different than that first time. So I'm accepting the help.
You're accepting the help. So accept the help, ladies. Don't say no. We can do a lot, but childbirth is different. So just accept the help of it.
And you're still a strong woman. Even though you need help, you're still strong.
Yes, it does not detract from that. What about you, Eka? What advice do you have for moms that are going through something similar that you've been through?
I completely agree. Help is very, very necessary. I find when women say, oh, we just want to be like by ourselves with the baby, I'm like, no, I need everyone there. Mom, my sister, the other mom, other sister, everybody. But even still, like, like you were saying, like I guess I will learn from you from there, because this is now your second child, and maybe when I have my second child, that's when I'll be less anxious, because like you just want to know everything that's happening at every particular time. And it can be, I guess, yes, very debilitating for you to just be thinking about one thing all the time, no time for yourself. So gently, I am getting there. But that comes with having that support there, I would say. So
Yeah.
the support is important, and people recognizing what these things are as well. I guess we come from a time or a different generation where women were always at home with the baby, and you're just at home with the baby, and you're just baby, 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 baby. But we don't live in those times anymore, and so people acknowledging that, husbands, grandparents and stuff, to say, oh, do you want to go out today, and then I'll keep the baby, stuff like that. So it comes with just education across the board.
Yeah. Well, thank you, Eka. And what about you, Dr. Clark? What advice do you have for all the new mamas out there?
Yeah, give yourself grace. I, just echo the need to be okay with accepting help. So often I have patients tell me, or even new moms that are in my family and among my friends, they say, "Oh, well, I don't want to impose on anybody," and I'm like, "No, ask for the help that you need." Many times, family and friends are willing. We just don't know. We're not trying to be intrusive. Everyone comes at the same time sometimes. So I also say not only accept help, make sure people are coming to help, not just hang out and, hold the baby. Yeah. Like we need you to do some dishes, let me sleep. And more importantly, if you have a partner at home, a lot of times patients will also say, oh, well, he doesn't know how to do it. He doesn't know how to do that. Well, he will never learn if you do not let him. You didn't know either at one point.
Release the reins, lady. Release the reins.
Release the reins. Let him learn so he can help you. Okay.
Yes. Well, thank you all for joining me today. I'm super happy that we had this conversation. It's so necessary, especially, right on time for Black Maternal Health Week, but it's just a conversation that's hopefully going to encourage and empower a lot of women who have watched it, whether they're watching it now or watching the replay. If you're on this postpartum journey to healing your mind, body, and soul, like Dr. Clark said, give yourself grace, be patient, and just know that your healing is going to come. Your body is transforming. It's not damaged. It's just different. So definitely make sure you share this episode. Share it with the people in your life that might need to hear what we've talked about today, and continue to be encouraged today and always. I will see you all again next week. Same time, same place. This has been Jumping with Jumi. Have a good night, y'all. Bye.
Thanks, Jumi.